course, it's not just about the income coming in, but it's taking care of taxes, taking care of healthcare. It's no surprise, actually, the latest estimate when it comes to maintaining healthcare in retirement, well, it is on the rise once again. New numbers from the EBRI, the Employee Benefit Research Institute, find the typical U.S. couple is going to need as much as $413,000 to cover medical expenses over the course of their retirement, which is an 8% increase from, just a year ago. The number keeps going up every year, and that is probably going to continue. Is this number, when you tell them how much it's going to be on average, is that shocking to clients? And how do you help build healthcare into that financial plan?
Yeah, $413,000. I can remember a couple of years ago, I think when they talked about it, it was roughly $250,000. So healthcare costs, continue to really skyrocket quite a bit. This is a really good topic here. It's talking about how do you build healthcare into a financial plan. It's one of those areas where I think it's so important because of these things overlapping each other, and I think that's one of the unique things that we offer here at America's Retirement Headquarters is not only giving you the financial advice, but having Scott and his team on the healthcare side as well. I met with a couple last week. Dave came into the office and we were going through his financial plan, and one of the things that David mentioned to me is he said, I'd retire now if it wasn't for the healthcare cost. And, he's before the age 65, before going on Medicare. And at the age of 62, he really would like to retire, but, he was just shocked to learn about what the cost of the affordable healthcare would be based upon some numbers that he had taken a look at. But, what Dave didn't realize is that through some proper financial planning under the Affordable Health Care Act, it is an income, not an asset test. So, based upon the amount of countable income that him and his wife have through like Social Securities or pensions or IRA distributions, that is really what determines his monthly premium. And actually, if Dave just simply moved around and took money from not countable sources, in this case, if he took the withdrawals in the early years from his non-retirement account, that wouldn't be considered countable income. And we were able to show him a way to basically eliminate what his monthly healthcare premiums would be. Now, he could have an out-of-pocket maximum of about $7,500, but that's only if something bad happened. And virtually through financial planning and just knowing how to navigate the landscape, we were able to get his premium to really go down to zero and be able to put him in a position where he can then confidently and comfortably retire. I also met with another couple last week, Dan and Lori. And so one of the concerns that Dan and Lori had is they had experienced in their own family their parents needing long-term care. And they thought, while we're young and healthy, let's kind of get this checked off the box because, at $10,000 a month, it's no wonder that the average U.S. couple needs as much as $413,000 to cover medical expenses, and that can spiral out of control. In fact, I had another client in last week. His wife was in a long-term care facility for quite a few years, and he added it up. And I think the course of their lifetime, their long-term care policy paid roughly $1.5 million. And had they not had that type of protection, they would have had to write checks out. So Dan and Lori, in their situation, what they did is they used an annuity that, number one, is it provided them reliable income down the road in retirement time. So I think it's important to have plenty of reliable income to cover your minimum monthly income needs. So one kind of checks the box on that. But the other unique feature about the annuity is in the event that they can't perform 2 out of 6 of their activities of daily living, their income doubles in the form of payment to help them reduce and offset some of the costs that could be associated with long-term care. So in a lot of situations, what you want to do is you want to look at how do you leverage your assets to build a protection around your assets in the event for healthcare costs. Also, like in the example of helping Dave retire, how to navigate the system. And that's, absolutely one of the things that we do here. So if you're worried about long-term care in the future, or you're worried about, how do I structure things to get myself in a situation so I can retire before the age 65, and healthcare is on the list, absolutely, let's have a conversation. Let's talk about it. And when you're looking at developing a plan, What you want to do is, first of all, is you want to understand what your current health insurance is. So you got to review your existing health coverage, understand what's included, what's not included, know what those deductibles, those co-payments, co-insurance amounts are. Familiarize yourself with any type of restrictions that you have in your plan. Number two, make sure that you always have money set aside for an emergency so you can cover some of those maximum out of pockets if something big does happen. That way you have that financial safety. Number three is budgeting for healthcare costs. So in the example that you mentioned, Chris, if it was $400,000 that you need, make sure that you have one of the buckets of money that's designed to help cover those annual healthcare expenses. And that could be things like the insurance premiums or those deductibles or out-of-pocket expenses. Number four, a health savings account or a flexible spending account. If eligible, you can contribute to a health savings account, allows you to save money tax-free for qualified medical expenses, or consider participating in a flex spending account, which also can provide some tax advantages for medical expenses. Number five is include health insurance premiums into your budget. So when you're looking at what is your income needs in retirement time, make sure that you budget that in. When we develop a financial plan, we'll generally build in about $5,000 a year towards healthcare expenses. And by doing that, it's number six, allowing you to plan for retirement health cost. And again, understanding when you transition into Medicare, what is covered through Medicare. Are you going to need an Advantage plan? What is the deductible? Are you going to get a supplemental plan? What is the cost of the supplemental plan? And then also realizing, what are the things that are not covered? Like, as an example, in most situations, long-term care is not covered in traditional Medicare or an Advantage plan. Something that Chaz on the radio talks a lot about is the step number 7 is being proactive and taking those steps to stay healthy. So it's staying involved in the community. It's going to the why, being involved in healthy choices that you have, and looking at number 8, health and wellness programs that are out there. Number 9 is review and update things annually. So whether it's your Medicare premiums, right now at this time of the year, there's still a couple of weeks left where you get an opportunity, if you made a change to your Medicare, where you could look at making a change to your Medicare plan before you're locked in for the rest of the year. So if you're not sure if you're in the right health insurance, again, another reason why to reach out to our office, let's look at your health insurance and make sure that you made the right decision for 2024. And the final thing, number 10 here, is to consider long-term care planning. So whether it's veterans benefits, whether it's long-term care insurance, whether it's leveraging life insurance or an annuity, but making those decisions while you're young and healthy can be a great way to help out. And those would be the steps that I would talk to you about on how to help build healthcare into your financial plan.
Because it's one of those things where you are going to encounter, some form of healthcare needs. As I said, the average these days is about $400,000 for a couple that is entering into retirement. That is more than likely going to go up in the future. You don't want that to be the reason that your retirement plan falls apart. With a little bit of preventative care, just like with healthcare in general, it can hopefully mitigate the effects of that. And that all starts with sitting down and speaking with the team at American Headquarters, 419-794-3030. You can also find out more about the team and schedule a time on the website as well. That is arhq.com.